Hi, it's Dr. Manali Desai. Today I'm going to be talking about keeping your health goals long term. A lot of people make new health goals in January, but like we all know, those can be hard to maintain long term. But it is important, like you probably already know, cardiovascular disease is unfortunately still the #1 cause of death in the world. And a lot of the risk factors for cardiovascular disease can be formed by not being able to exercise or eat healthy, and that can contribute a lot. So a lot of people make goals around them, but then we're not able to keep them. And so one of the reasons that can be true is, a lot of bad habits that we develop around eating and not exercising can form when we're children, when our neural circuits are still connecting. And bad habits you form as a child, because your neural circuits are still connecting, can get hardwired into your brain and then are much harder to change as an adult. And so that's why it's important to consider those things about, like you might have always hated gym class when you were a kid, not related to exercise, you just hated gym class, but now you also hate exercise classes as an adult. And that formed, that it doesn't have to do with willpower, it's just that you formed that habit as a child of hating exercise or hating gym class, and now you hate it because of that. And so those are important things to consider, that, it may be that most people need to make one small change at a time, because if these are bad habits you've had for a long time around eating healthy and exercise, then changing them all at once can be difficult. There are maybe, I would guesstimate from my patients, about 5 to 10% of people who can dramatically change everything all at once and actually maintain that long term. But I don't think that has to really do with willpower or anything like that. I think, some people are just all or nothing people, and that's how they operate about everything. And that's not most people. Most of us actually need to make one small change at a time and then layer those changes on top of each other. And so what I tell most of my patients is to pick one thing first, either around exercise or eating healthy. And I would pick only one, because if you hate both eating healthy and exercising, doing both at the same time and then doing it for the whole year and next year and the year after is going to be really hard. So pick one thing at a time and try that for 4 weeks. Pick one thing to change, try it for 4 weeks and see if it's working for you, troubleshoot what you can. And if it's not working for you, let it go and try something else. If it is working for you, then add a second change, around diet, eating healthy or exercise after that, and kind of make one change at a time. I think a lot of times because of social media, we want to see dramatic changes that can be photographed, but being in good health doesn't necessarily lead to dramatic, changes you can see on photographs. A lot of times it's just knowing you're in good health. And so that's important to consider as well, is that, even if you're making small changes, you may not see externally a huge, massive change all at once, but that's okay, because as long as you're moving towards better health, that's good. We want to be in, good health for the rest of our lives, ideally, or for as long as possible. And so these are changes you want to commit to forever, ideally, because you want to be in good health, forever, or as long as you can. And so that's why it's important to think of these as, small steps you're making forever for yourself, not for the pictures or not for, the video content, just because you want to be in good health. That's all for today. For more videos like this video and subscribe to my channel. I'll see you next